Hello everyone, this is Dr. Lakshmi Kalbande. I am practicing as a consultant obstetrician and gynecologist in Cloud9 Hospitals, Pimple Saudagar, Pune. So many patients come to us and ask during the pregnancy itself that what is the best time to get an epidural, or when will you be able to give us the pain relief. So this is the most commonly asked question by anxious couples. So pain relief, as we say, labor analgesia, that can be given in the first stage of labor, that we say that around 2 to 3 centimeters if the patient is dilated. So for that amount of dilation, some patients may need to be in labor for quite some time, maybe 4 to 5 hours, maybe 1 to 2 days even for first pregnancy when we consider. So unless and until the patient is approximately 3 centimeters dilated, before that we generally don't prefer to give labor analgesia or epidural. So first and foremost, the reason being that the patient might not progress in labor, and secondly, it might be false labor causing no dilatation at all, and unnecessarily we are administering an anesthetic agent without anticipating delivery. Thirdly, it may so happen that the plan of trial for normal vaginal delivery or vaginal delivery is abandoned due to some other maternal conditions. So all these reasons being considered, before 3 centimeter dilatation we do not prefer to give labor analgesia or epidural analgesia. I just wanted to tell you all that how long the labor analgesia effect lasts, that is also dependent on the dose that we give. The dose of the anesthesia also depends on the weight of the patient and the stage of the labor that the patient is in. So for the approximate part, if one dose of labor analgesia is given through the catheter that is placed in your back, it usually lasts up to 90 to 120 minutes on an average. So for some patients it may last a little bit less than that, for some patients it may last a little bit more than that. So anything which is, if the effect is not there, that means maybe the catheter is not placed in the correct position, or the dose is less enough not to have any effect. The problems may be innumerable, but we do tackle some patients who do not have the appropriate effect, and then we have to replace the catheter as well. So on an average, I think 90 to 120 minutes is the sweet spot that we can expect the labor analgesia effect to last.